Sometimes we just take things like this for granted. Little well, we don't always take it for granted, but we have people that are around us that take it for granted. And I think we need to talk about it a little more. And we're going to talk about these issues that are underlying and keep getting hidden, even though they're right in plain sight. So let's talk about mental health disparities in Black communities. Now, y'all know I am one that will read articles and stuff. I try to stay up to date with this type of information when it comes down to mental health, because we know that mental health, it can be challenging for all races, okay? I want to say that first of all, that it is challenging for all races, and that all races do suffer with mental health, and somehow mental illnesses worse than others, just depending on who the person is, But the thing is, it's not the fact that we're all suffering. The problem comes when we're not all getting the same equal health care, or we're not getting the same benefits as far as mental health care. And I have been one, I have just sat back and I have watched how Black people are treated so much differently from white people when it comes down to mental health. And this is no shade to the good people out there, but this is the truth and the facts that we must pay attention to if we're going to live quality lives. We have to speak up for those who cannot speak for themselves. And some of those who cannot speak for themselves is some of them who are plagued with mental illnesses that nothing is getting done about. And the only thing that most of these mental health facilities are doing are just prescribing more and more prescriptions, and not really taking the time to see where this illness is coming from. Now, this is something that a lot of people don't know. Most mental illnesses are induced by environment conditions, induced by poverty levels, like financial issues. It's induced. If we can work with people and find out what causes them to get in the mood or change moods, or, become depressed, have anxiety, if they would take time to get to know that part and that side of Black people, then yes, a lot of Black people would be well off mentally and wouldn't have to be on so many medications. Now, the thing that caught my eye in the article that I was reading, which was actually called, let's get to it, Black Mental Health, What You Need to Know. The topic of mental illness is often taboo in Black communities. If we eliminate the stigma, can we help people get the mental health care they need? First of all, I want to say this. If we're going to get mental health care right, we're going to have to start holding these people accountable. Because for one thing, Black people do know what mental health is. They don't know every term that's in the DSM-5 book. They don't know that. Sometimes they don't even know the term of what they're going through. As a matter of fact, some of the Black people, when I was growing up, this is what they say, my nerves working with me. They knew something was off. They knew something was making them feel different, but they didn't have the terminology for mental health. And that right there alone, that pushes them back, but it doesn't mean that they don't know that they're dealing with something. And we need to step up on that part and stop saying it's taboo in the Black communities, because it's not taboo, because everybody got an aunt or uncle that they remember at some point that whenever they got drunk or either they got high on drugs, that the grandmother had to come in and nurse that person back to health. I don't think there's too many households in like the in the poverty communities that didn't go through stuff like this. We experienced this. We live this. So when you tell us that it's taboo to us, you're trying to make it seem foreign to us. But we've been living with stuff like this. Now, some people didn't know how to overcome it, and then there was some who did. Now, I had a grandmother who knew how to help people overcome it. When she would see people come in and they be drunk, sloppy drunk or something, she would get to getting them some air so they could sober up and stuff. And then she would talk with them and she would ask them, what made you do this today? What made you drink like this today? And then that person would begin to just tell the whole story of why they started drinking. And then if you actually sit and listen at some of the people who have mental illnesses due to induced mental illnesses, not born with this stuff, it's from traumas. It's from traumas that have happened at home. It's traumas that have happened on the job. It's traumas that have happened at doctor offices, stores, everywhere around us. Is all these giant traumas waiting to happen. And that has happened in the Black communities. So we do know about mental health. It's just that we don't follow through with it. We don't go to doctors and stuff. We don't go see psychiatrists and stuff. A lot of people don't. They don't go see psychiatrists. But if we just let people, if we meet people where they're at, because they do know. A lot of people do know. They just fix it, self-medicate and stuff. All right. So let's move on. So, as we get down a little further in this article, I want to see which part I want to talk about, because I know I'm probably not going to have time to talk about it all. There was something else I wanted to read you at another side here. Let me get my slide up, if that's all right with y'all. I want to just read you this. What it says is health disparities. This is coming from the CDC, by the way. Sorry about that. Health disparities are preventable. Differences in the burden of disease, injury, violence, or inopportunities to achieve optimal health experienced by socially disadvantaged racial, ethnic, and other population groups and communities. Do you see what this says? The CDC says this is preventable. Most of these health problems that we're going through is preventable. Most mental health illnesses are preventable. They are preventable. Not everybody is born with ADHD. Not everybody is born with anxiety and depression. But we have to see where it's coming from. And a majority of times where it's coming from is this racism stuff that's going on. Now, I know a lot of people are like, oh, we so far up out of racism. But honey, no, we not. We are not far up out of racism. I was at a therapist's office in 2023. And in that therapist's office where I went to, I actually left that office before they would doing treatment with me. And the reason why I left was because I felt like the woman was trying to hold me back. She wasn't trying to see my mind heal. She was trying to focus on things that I had already overcome. And that's what's happening. When we send people out to therapists, they looking at the money. They're not looking at the fact that you're a real person. Can I say this? If you are a Black person, you're going to be treated like an object. I don't care how much money you got. They still going to treat you like an object. And at some point, they going to let you know that you are an object. It got to the point where I started walking into certain offices, and I just sit there and I look around at how everybody was treated. Well, I'm going to tell you how it was treated. Now, you would get the Caucasian people, they were treated nice. Their name was called right. Their name wasn't called like they were stupid or like they couldn't understand the language. Y'all don't hear what I'm saying. Everything a person does to you is intentional and it's systemic. Some of this stuff that people are doing. If you walk into a mental health facility and you got a Caucasian person on the left and they call their name, I'm going to say, hey, Miss Linda, come on back. You talk to Miss Linda like she a real person. But then when you get this Black person come up on this side, you talk to them, is your name, what are you here for? And you act like you don't even know why they there. So why would they want to come back and get treated by you? And this is some of the microaggressions that are out there that black people are facing when it comes down to getting their mental health taken care of. They have to deal with that. They have to deal with that racism from the mental health facility. They have to deal with it on a daily basis, just going from jobs, homes. It's so much to consider when we are talking about these disparities in black mental health communities. Okay, so let's read what this article goes on to say about racism, trauma, and mental health. Black Americans develop mental health conditions at a rate equal to anyone else. The Centers for Disease Control has declared racism a serious threat to public health. Now, I want to tell y'all, this article is only 1 year old. This article was written in January 2023. When I saw that, I said, yes, we're dealing with a lot. We're dealing with a lot of stuff that people want to hide. These are the things they don't want you to know, is that racism still lives. And because it's still here, it's still taking tolls on innocent people's minds. Just as I said, black people have always known what mental health was. We didn't call it mental health. We called it taking care of a person. For the sake of somebody getting paid, you got to call it mental health. You got to give it a diagnosis. You got to give it a name. Because if you don't give it something of a diagnosis or a name, guess what? The provider cannot get paid for. They can't get paid if they don't have a correct diagnosis. And if that diagnosis ain't in the DSM-5 book, they're not going to get paid just off of you going and just having a conversation. They need a diagnosis in order to be paid. Do you hear what I'm saying? So they may tell you that you have something that you don't have. You may have general anxiety, but they're going to label it schizophrenia. Yeah, because I get to see you more and I'll get paid more. Your insurance is going to cover. Let's go get you that insurance. You don't got insurance? Let's go get you some Medicaid. Let's see if you can get approved for this and approved for that. But it's not out of your well-being. It's just because they want to get paid. Okay? So we already see that the CDC says that racism is a big part of this. I gotta get back to where I was reading from. I lost my place. I got excited and I lost my place. But yes, racial trauma is a thing. Okay, so we're at the point now where it's declared racism is declared a serious threat to the public that has placed communities of color at greater risk for poor health outcomes. This is why black people don't want to go to therapy. It's because we know that we're better off trying to use grandma and grandpa's remedies. Even though that doesn't work, but that's what the mind has picked up on from the hate. And those who self-medicate turn to weed, alcohol, any type of opioids and drugs that they can get just to get by. You know, DMX had a song, I keep slipping and falling, I used to get high just to get by. That song was, he wrote that for real. That wasn't no play stuff. That was real. People got high to get by. People are still getting high to get by. And it's because of these underlying threats of racism. And it causes a person to not want to go and get help. Okay, let's read some more. When considering the mental health of Black Americans, it is important to view their experience through a historical and cultural lens. The Black community has shown resilience in the face of adversity for centuries. I'm going to stop right there. I'm going to tell you something. Have you ever noticed the people, Black people who are on these medications for mental health, they get worse. I watched